Morning all, we're going to chat about the lymphatic system and our body's defense systems. The lymphatic system is actually really easy to understand, the first part. The body defense systems, I'm going to try to keep it simple, but it can get pretty confusing. Anyway, the lymphatic system is pretty easy to understand. If you've ever been involved with building a house, or maybe you have friends or family that own a house, they would be concerned about water getting into their basement. And what the builder would have done, ideally, is put in some drain tile around the outside of the concrete of the basement, or the cement of the basement. The drain tile is designed to pick up excess water and take it away from the surroundings of the basement, so the basement doesn't flood. Well, I explain this because the lymphatic system works pretty much like that. It's a drainage system in our body to drain excess fluid and return it to the blood. It also is very smart because it has filters along the drainage system to inspect and deal with things like cancer cells and microorganisms, as well as it possibly can. So we're going to have lymphatic vessels, so those would be all the tubings basically of the lymphatic system, and then we've got some lymphoid tissues and organs that we're going to study. We know the main role is to collect excess fluids in the body and return them to the blood, and that we have this filtering system throughout the lymphatic system that acts in body defense, as in if it sees a microorganism, it can try to deal with it within the lymphatic system. So if the lymphatic vessels are designed to pick up excess fluid, you can probably understand that if a patient has a tumor compressing on the lymphatic vessels, let's say of your arm, just to make it easy, then would the lymphatic system be able to drain the arm properly? And you probably understand that it wouldn't, and that fluid could then easily accumulate in that area. So one of the things that we see with our patients is compression of lymphatic vessels because of tumors, and that leads to swelling, and it helps us understand how the system works. Here's a fantastic slide showing the relationship between the arterial system of the cardiovascular system and the venous system of the cardiovascular system, and then in green there are the lymphatics. Okay, so let's look at the bottom. At the bottom we have capillaries, and a lot of fluid leaks out of the capillaries into the tissues. We know that the lymphatics will pick up excess fluid, and look at them doing that. There are lymph capillaries. They're dead-ended, meaning they don't create a continuous circuit. They're just ends, like branches of a tree. And there they pick up excess fluid. There are little valves within that ideally should be one-way valves and prevent backflow in the lymphatic system. And then fluid moves up and up and up. It goes through lymph nodes, which are bean-shaped and about 1 inch long. The lymph nodes are filters which contain lymphoid tissue, and they're able to recognize invaders like microorganisms and try to deal with them as well as possible. The fluid continues to make its way upwards and gets dumped back into the venous system. So lymph is the fluid that's within the lymphatic vessels, and it is flowing in a one-way direction towards the heart. If we look at the lymphatic capillaries, they're at the very end, they're able to absorb fluid, aren't they? So they weave their way between tissue cells and blood capillaries. They're kind of in that area. And they have these flap-like mini valves. They call them little tiny openings that can allow fluid in, and then fluid doesn't go out. So the fluid leaks into these capillaries, and when there's enough fluid inside the capillaries, those little one-way valves close, so it doesn't leak back out. So the lymphatic capillaries pick up the lymph fluid, it drains into the lymphatic vessels, and we know that the vessels have these little filters, the lymph nodes within them, and then fluid is returned to the veins very close to the heart. So just as it says here, the right lymphatic duct drains all the blood flow from the upper right hand side of the body. So it includes the right arm, the right side of the head, and the right side of the thorax. The thoracic duct drains lymph from the rest of the body. It's just kind of interesting because it's not a symmetrical system. It's actually asymmetrical. It's meaning that it's irregular. Oh, there's a lot to chat about here. What we see is that there are multiple lymph nodes spread throughout the body. These 1 inch long bean-shaped filters. If you've ever gone to your doctor and complained about an infection, your doctor may have palpated or felt these little filters, these lymph nodes, to see if they were swollen. Now let's look at some of these and commit some of them to memory. We have cervical nodes, axillary nodes, inguinal nodes, for example. Also, I just want to notice that lymph is dumped in two different ways, just like we mentioned on the previous slide. So the upper right hand side of your body, basically, all of that lymph fluid gets dumped by the right lymphatic duct into the right subclavian vein, which is shown here. Okay, the remainder of your body, the other 3/4, is kind of shown in pink in this image, and it's dumped in through the thoracic duct into the left subclavian vein. So how is it that this lymph fluid is transported through the lymphatic vessels when there is no pump to do so? Well, there are a few ways. One is because of movement. For example, when we get up and walk around, we are using our muscles in our calf area, and the squeezing of those muscles helps squeeze the lymphatic vessels, and that helps move lymph through the lymphatic vessels. So movement is important. Also, when we breathe in and out, we change the pressures in our thorax slightly. When we inspire, the pressures in our thorax become negative. When we expire, the pressures in our thorax become positive. These pressure swings actually assist in the movement of lymph fluid through the lymphatic vessels. Also, there is a little bit of smooth muscle in the walls of the lymphatics. A lot of these things about the lymph nodes already. Let's get a little bit more specific about the defense system in our lymph nodes. So these filters are so smart and so strong in terms of defense. There are macrophages, which are able to phagocytize. That means that they engulf and destroy bacteria, viruses, and other substances. And then there are lymphocytes. We're going to learn lots about those. They're able to respond to invaders in the lymphatic system. Now, we've talked about sort of the circulation of lymph fluid in the lymphatic vessels, but there are some other organs associated with the lymphatic system. They're listed here. We have tonsils in the pharynx, thymus in the thorax, spleen in the abdominal area, I guess it would be the upper left of the abdomen, Peyer's patches in your intestines, and we have the appendix. So let's take a look at what these structures do. I've had quite a few patients that have had a ruptured spleen due to trauma, like car accidents. If you rupture your spleen, it's pretty risky because you could bleed out internally. That means that blood is going to pour out of that area and into the abdominal area. And this is very dangerous. Patients like this may have a splenectomy where the spleen is removed, and you can actually live without your spleen, interestingly. So let's take a look at what the spleen actually does. Well, the spleen is able to deal with bacteria and viruses and other debris and clean it up and sort of neutralize it. Also, it is a site where some types of lymphocytes will proliferate and grow. The spleen is also able to break down and recycle red blood cells, and it acts as a reservoir for excess blood. Okay, MALT, mucosa-associated lymphoid tissue. Some examples are listed here. These guys act to protect areas of the body that are exposed to the environment. So think about the respiratory system and how it's really open to the environment. Well, we need to do our very best to protect our body from invaders coming in that way, and the tonsils do that. In our gastrointestinal system, well, we expose our bodies to all kinds of microorganisms through this way because we eat foods sometimes that aren't perfectly clean, for example, and may contain microorganisms. So we've got Peyer's patches and the appendix to help deal with that in the intestine. The thymus we're going to be chatting about more coming up in the immune section of this PowerPoint. We've talked about the tonsils and the Peyer's patches already. Next, we're going to talk about the body defense system. We have an innate defense system which fights all invaders and is not fussy at all. An example of that would be our skin. You know, it's a barrier to invaders. It's not specific to any one invader. The other type of system we're going to talk about is called specific defense system, and that's where we're going to get into talking about B cells and T cells and their ability to recognize certain pathogens and to fight those pathogens. The term immunity, well, that would be like if I said I was immune to measles. That means that I am resistant to that disease, measles. And when we think of the immune system, they use this term functional system rather than anatomical, because it's a functional system that's spread throughout our entire body. It's not neat and tidy like the cardiovascular system, which has a heart and blood vessels, for example. This system is spread throughout the body, and in fact it's pretty mobile, because we will learn that cells actually move in and out of the bloodstream in order to work in the immune system. Here we start off on the left talking about that innate or non-specific defense mechanism, or category, I should say. And again, it means non-specific. It just means it's not specific to any certain pathogen. It's just a general fighting mechanism that we have. So our first line of defense is our skin, and isn't it awesome? It's a physical barrier, and we're going to learn that it's a little bit acidic as well and has a few other features to help fight off invaders. Our mucous membranes, for example, line our respiratory tract, because we could breathe in a pathogen and that could cause us some harm. So we really need to have some kind of system to fight those off. And how about secretions of our skin and mucous membranes? How are they involved with fighting off pathogens? We're going to learn that as well. The second line of defense, again, this is non-specific. These are just general fighters. They're very good at helping us fight off pathogens. We have phagocytic cells. They simply engulf cells just like Pac-Man and digest those. Natural killer cells, which are just exactly what they sound like. They actually kill pathogens that come in, and they don't care who those pathogens are, they're just going to kill them. Also, we have antimicrobial proteins. We're not going to spend too long on that. There's the inflammatory response. We've probably all seen that before. An example of that would be when an area becomes red and swollen. That's part of the inflammatory response. And why do we have a fever, and what is the benefit of having a fever in terms of fighting pathogens? Then next, we see in blue, we're going to be talking about the third line of defense. Now, this is a very special system involving B cells and T cells, for example, that are sort of customized cells to fight specific pathogens. So this is going to involve lymphocytes, antibodies and antigens, and macrophages and other antigen-presenting cells. So the innate or non-specific defense system, including things like the skin, are really immediate, and they protect against, a wide variety of pathogens. It's not specific at all. Whereas the adaptive specific defense system deals with individual types of pathogens. Sometimes the system takes a little longer, and it deals with the invaders that get through the first type of defense system, the non-specific defense system. This is a good point in this slide. So what are pathogens? Because we're going to talk about those a lot. Pathogens are harmful or disease-causing microorganisms. So they're invaders into our body. So we know that we have skin and mucous membranes to help protect against those, some special human cells that we're going to be talking about, and chemicals produced by the body. For example, some of these chemicals produced by the body rise up are excreted onto the surface of the skin and help make it a more tough environment for a microorganism or a pathogen to survive. So the skin, for example, provides a physical barrier for pathogens and microorganisms. But let's look at how these barriers have special qualities to make it even harder for a microorganism to survive. The skin, for example, has a little bit of acidity to the secretions that are on the surface. Mucus that lines our mucous membranes traps is sticky like a fly trap. Think of that, a fly trap in an old barn, and how a fly would stick on that. Our mucous membranes act like that. They're mucus traps for microorganisms. Also, in our stomach, we have a very acidic environment. The pH is between 1.5 and 3.5. And this is really a great decontamination chamber, we could think of it as, because if we were to eat something that contained microorganisms, my goodness, that microorganism has to survive a very acidic environment in order to continue on in our gut. Hopefully it will get killed in there. Also, things like our saliva and our tears have special enzymes that help destroy bacteria. So we can see that we have all of these defense mechanisms that are very generalized to help, generalized or non-specific, to help fight off invaders from getting into our body. So then, what are some of our second line of defenses to generally kill bacteria or viruses or other invaders? Remember, these are non-specific, so they're just very general. Things like natural killer cells, they're able to kill cancer cells and cells that have viruses in them, for example. Phagocytes, they just engulf things like Pac-Man does and basically digest them. Then we have the inflammatory response. This is very important. There are many portions of the inflammatory response. We're going to talk about them more, but just to introduce them, it causes redness, swelling, warmth in the area, and pain. And I think of this, if we were to injure our elbow, for example, and we have an inflammatory response happening there, almost like we form our own little cast in that area because we have tightness and swelling in the area. It's very hot because a lot of blood flows to the area. And it's very painful, and that will make us protect that joint, won't it? And we won't really use it too much. We'll give it a chance to heal. Also, there are some chemicals that are emitted that help kill some pathogens, and we develop a fever. And believe it or not, fever helps reduce the multiplication of pathogens. This is such a great slide to look at what happens when we injure ourselves. So let's say we cut ourselves on a piece of glass, just like is shown in the image. Well, there's a lot of stuff that goes on behind the scenes that we take for granted. These cells that have become damaged release things like kinins, histamines, and other chemicals. This is called chemotaxis, when a chemical is released to cause other cells to be attracted to the area. What these cells do is they cause vasodilation, and I'm looking at the left of our image right now, vasodilation. This increases blood flow to the area, so we're going to get more blood into the area. This causes the appearance of redness and the warmth that we could feel at the site. What this increased blood flow does is it brings more nutrients and oxygen to the area, which will help healing. It also increases the metabolic rate of those tissues in that area, and because it's warmer, because the whole area is warmer now, and that also promotes healing. Let's look at the middle of this. Those chemicals that have been released by the damaged cells also cause the capillaries to become very leaky, so that fluids and cells can easily leave the capillary and move out into the damaged area. This causes edema or swelling in the area, and also causes pain in the area, which is actually a good thing, because then we will guard and protect that area, and that will allow it to heal more effectively. Also, because the capillaries become leaky, we can have more clotting proteins in the area to form a fibrin barrier so we don't bleed out. That's a good thing. And these things, just going back to the pain and swelling, actually make it so that we don't move our joint as much, and that promotes the healing as well. Now let's talk about the far right. So again, the damaged cells have released a lot of kinins, histamine, and chemicals that attracts, chemotaxis attracts neutrophils and then monocytes, which are another type of white blood cell, into the area. What these cells do is remove damaged or dead tissue cells and pathogens from the area. All of this helps with the healing process. I just want to point out those 4 things that are in red though: redness, heat, pain, and swelling. These are the indications of inflammation in an area. Sometimes, for example, we might have a trach patient who has a stoma in their neck, and there's a plastic tube going through called a tracheostomy tube. And what we need to keep an eye on is for infection or inflammation in the area. And these are some of the symptoms we would look for in the patient: redness, heat, pain, and swelling. We may also see pus, let me just add there, which is sort of residual cells from fighting infection. Why do we even have an inflammatory response? What is this all about? Well, one thing is we want to enclose the area. The body wants to sort of put margins around this area, or a barrier around, so that those pathogens won't spread to other areas of the body. The body also wants to get rid of all the cellular debris and pathogens through phagocytosis, and the body wants to start to get ready to have repair. Look at what neutrophils do. Well, starting at number 1, neutrophils were floating along in the bloodstream, and they came from bone marrow, hanging out in the bloodstream. Now, what's happened in this patient is the patient got a nail in their tissue, and this caused the cells to release chemicals to attract things like neutrophils to the area. This is called chemotaxis, that idea of releasing those chemical messengers. So chemotaxis causes the second point to happen, diapedesis, which is when the neutrophils leave the capillary and move out into the tissue where they need to do some work. And then number 3, they move all the way up to where the injury is. We've been talking about phagocytes. They engulf foreign material, just like a Pac-Man. The examples that we talk about here are neutrophils and macrophages. Regarding fever, it's actually beneficial. It's a response to pathogens invading the body. And what happens is the hypothalamus resets the target temperature of the body to a little higher. This decreases the release of iron and zinc from the liver and spleen and decreases the multiplication of the bacteria because they needed iron and zinc. Also, having a fever increases our metabolism, which increases our speed of repair. Now we're going to talk about the adaptive body defenses, or also known as specific body defenses, or the third line of defense. We have 3 names for that. But what to really understand is that this is our specific system. For example, if TB, tuberculosis, enters your body, that is a specific foreign invader, and we have a system that can work specifically on the TB. So that is what we're talking about here. There are 3 aspects of this system. Antigen specific. It means that the adaptive defense system recognizes, so it's able to identify and act against a particular foreign substance like TB. It is systemic. It goes through the whole body, and there is memory involved. The adaptive defense system recognizes and mounts a stronger attack on previously encountered pathogens. What this means is, if you've been exposed to a virus once before, and then your body sees this virus again, maybe 5 years later, its response is going to be more speedy and greater. And this is the rationale for giving immunizations. We expose the body to a small amount of dead pathogen, so it can teach the body what that pathogen looks like and have a memory for if it comes back. When it has this memory of seeing it before, it's going to fight more speedily, faster, and stronger. Antigens are substances that our immune system thinks are foreign. So some great examples are listed here, like foreign proteins like peanut butter. It could be something that triggers a reaction, for example, or pollen, microorganisms, or if you had a kidney that was donated to you by a donor, your body may recognize that it is foreign. So we know that white blood cells, also known as leukocytes, are our fighter cells in our body. A specific type of white blood cell is called a lymphocyte. And then there are a couple types of lymphocytes that we're going to talk about, B cells and T cells. So these lymphocytes, which are a type of white blood cell, they begin in the bone marrow, and they are produced from hemocytoblasts. The B cell type of lymphocyte mature in the bone marrow, and the T cell matures in the thymus. T goes with T, B goes with B. Just back to the B cells, they use antibodies. We're going to be looking more at antibodies, but the antibody types are listed here: IgA, IgM, IgD, which is involved with activation of B cells, and IgE, which is involved with allergies. That's important. Now, when we look at T cells, again, they're a type of lymphocyte, which is a type of white blood cell. They arose from the bone marrow, and they matured in the thymus, and they provide what we call cell-mediated immunity. These T cells actually fight pathogens directly. They do not make antibodies. We're going to look at how they do that. Focus on the top part of the slide. Just want to point out that we have hemocytoblasts inside the bone marrow. They are the origin of our B cells and T cells. And the B cells and T cells are differentiated hemocytoblasts. If it's a B cell, it's going to mature in the bone marrow. If it's a T cell, it's going to mature in the thymus. And we're not going to worry about the bottom part of this slide. So an antigen enters the body, some sort of irritant or pathogen. Dendritic cells, macrophages, or B lymphocytes are able to engulf the antigen. Then they break it up into little bits, strangely, and they stick these little bits or fragments on their outer surface. This process activates T cells. When B lymphocytes bind to an antigen, it causes them to produce tons of clones, basically reproduce. This is called the primary humoral response. Most of these clones are going to become plasma cells, and plasma cells produce antibodies that kill the antigen. Some of these B cells are going to become memory B cells, and they are going to remember that antigen if it's presented again in the body. Could be weeks later or years later. This makes it so that our immune system can fight harder and faster if it's exposed to the same antigen again. This is called the secondary humoral response, and it's called immunologic memory. We have our B cells floating around. Some of them are able to recognize an antigen. An antigen comes in and the B cell recognizes it, and it causes proliferation of the B cells. That means that they just multiply like crazy. When they multiply like crazy, we're going to end up with a lot of plasma cells, and they secrete more antibodies, which assist in the defense mechanism. But interestingly, we also end up with some memory B cells, and they're just like what they sound like. They are going to remember this antigen if it presents itself again, even if it's years later. So in the bottom box, we see that many years later, the same antigen enters the body again, but we have a memory B cell here that remembers, and it's going to cause a more forceful and quick response to that antigen. So that's what it says here. Subsequent challenge by the same antigen results in more rapid response. And look at how many plasma cells we have and more memory cells again. This graph kind of simplifies what we talked about in the previous slide. We're talking here about the primary response or primary humoral response and the secondary humoral response. So the first time that the body is exposed to a new antigen, it's going to have a response that's shown in the first part of the graph. And the second time it is exposed to the antigen, it is going to have a faster and greater response, even if it's weeks or years later. This is because of the memory B cells. Now we've learned that when an antigen enters the body and gets engulfed by some special cells, such as dendritic cells or B lymphocytes, and those cells expose the fragments of the antigen onto its outer edge, that activates T cells. Okay, so now we've got activated T cells. So now we're going to talk about something called cell-mediated immune response. It involves the T cells. The T cells differentiate, and they can become killer T cells, which are really good at killing things, so that's awesome. They can kill pathogens or cancer cells, for example. They can become helper T cells. Helper T cells do things like recruit other cells to help fight this invasion. They can also become regulatory T cells. Regulatory T cells are when it's time for things to settle down. Okay, it's time to end this big immune response. So they release chemicals to suppress the activity of the other T cells and the B cells, and this prevents like an ongoing continuous immune response. Some of these cells also become memory T cells involved with remembering the antigen. What happens with allergies? Well, allergies or hypersensitivities are really perfectly described here. They're abnormal, vigorous immune responses. It's our immune system going in overdrive, sort of unnecessarily. It's overreacting to antigens. You will deal with lots of these types of reactions in your career, so they're quite scary. It could be a patient who has an allergy to wasp stings, who gets stung and has a severe acute allergic reaction. This would be called an immediate acute hypersensitivity, seen with anaphylaxis, as it's mentioned here. IgE antibodies are involved and histamine, and this can be life-threatening. And it's very serious, and an EpiPen will help for sure, and calling 911, because we need to get this patient to the emergency department and give them lots of epinephrine. They possibly may require intubation as well, and drugs to keep their blood pressure up. There's another type of allergic reaction called delayed hypersensitivity, and it involves T cells and macrophages and cytokines, and it can happen 1 to 3 days after contact. And some of the examples would be with poison ivy exposure, for example.